Welcome to the Perry Health Pulse podcast, a program dedicated to taking you behind the scenes of healthcare, sharing firsthand knowledge from healthcare professionals, and putting you in the driver's seat on your journey to lifelong health and wellness. Listen and learn about how healthcare delivery is changing on our weekly podcast.
On today's episode, we're talking about chronic care, chronic diseases. It's something that's becoming very common, something commonly talked about in healthcare, but for some people, it's not really understood yet. So we've got two guests today. One is Deb Nissen. She's a nurse who works in our chronic care management here at Perry. It's a program that started just a year ago, and she works with patients who are referred to her. And we've also got Dr. Pomnani. He just joined the Family Health Clinic in August of 2019, and he'll also be working as a hospitalist treating patients who are admitted. Welcome.
Thank you.
Thank you.
All right, so starting out, over and over again, we're hearing the words chronic disease, chronic condition. What does that really mean? How's it different from what most people know?
So as per chronic diseases go, the CDC define it as any medical condition that lasts 1 year or more. In actual clinical practice, we can see them from 3 months, 6 months, or even more. So that's the basic definition, any medical condition lasting for a long amount of time, and that can affect individually in a very adverse way.
And what are some of the more common ones that people might have heard of?
The more common chronic diseases that we see in our day-to-day clinical practice are hypertension, diabetes, various types of cancers, COPD, CHF, and so on.
Now, obviously, it differs from disease to disease, but if people were to ignore chronic diseases, what are some of the problems that they could see?
Well, when they have a chronic disease, many times it'll start off in an acute phase. As time goes on, the body just gets worse and worse and declines. And so they'll have changes that will actually limit their daily activities and will make it so that they actually are at risk for self-care and taking care of themselves in a general way.
Many chronic diseases like high blood pressure that can lead to your heart failing or your kidneys failing can have increased risk of strokes. If you are suffering from diabetes for a long time and if you are not managing it properly, it can also affect your kidneys adversely. It can again increase your risk of cardiovascular disease as well as stroke. So it's very important to check those chronic medical conditions either by lab work or going to your doctors regularly to make sure you don't have a devastating outcome from those manageable chronic diseases.
And I've heard before about high blood pressure. Your blood pressure can change very quickly and not necessarily notice it. And just a couple months of it being very high or very low can cause a lot of damage.
You're absolutely right about that. High blood pressure can lead to vessels in your brain rupture. That can be very catastrophic. So it's a good idea to know whether your blood pressure is in the normal range or elevated, and to be on the medication if your blood pressure is running on the higher side.
In a rural area like this, is there any conditions that are more common than others or problems that you see more often?
We see a lot of diabetes, also a lot of COPD, a lot of breathing problems. Vascular problems are also an issue that go along with diabetes. Even depression and anxiety can be considered a chronic illness that goes along. It sometimes goes along with another chronic illness, or sometimes it's just the chronic illness itself.
Well, mental health is becoming a huge focus, so that's interesting. Is insurance looking at that as a chronic condition then?
Absolutely.
Now, are there ways to reduce the risk or recommendations you'd give people to avoid getting chronic diseases?
There's really no magic bullet.
Yes, agreed.
There's no single approach to any of these diseases. They all are very individualized because we're individuals.
Also, it's more kind of just having a general regular checkup. If you are in the age group of 40 to 50 years, at least have your blood pressure checked. It's a good idea to at least have a health maintenance or screening exams, regular blood work to check your kidney function, check your liver function, and so on. So just see your primary care doctor. They know you best. They will ask you proper screening questions, and they will order appropriate lab work to make sure all those diseases have not started developing. And if you are showing any symptoms or signs of those diseases, you are on appropriate medications to take care of them.
Well, that's another case where I've seen a lot of people who wait to go see their provider until something happens, and then they find out that they have a chronic disease that's really far down the line, and it's very difficult to treat. So having those regular checkups, you said starting around 40 or so?
40 to 50 years.
Okay.
And that's what you were absolutely correct on your point. We see many patients being admitted to the hospital, and then we find out they have new onset diabetes, they have new onset high blood pressure that they never went to PCP to get checked. So rural area, that's one of the things that awareness is needed and more knowledge is needed among common population. So just follow your PCP, make sure you get thoroughly evaluated, and keep track of your health.
My next question was going to be, how do a lot of people find out about the chronic disease that they have? And you kind of mentioned it there. They're admitted to the hospital and they end up, that's where it's uncovered. Are there other ways that detection might happen outside of getting regular screenings or being admitted?
They may be hospitalized for another reason. And just in looking back in their lab work or examining their health overall, sometimes the provider will pick up on something that's chronic that's happening.
Sometimes even job will ask you to get some health screening blood work or health screening examination. Sometimes even insurance companies, if you're applying for a new insurance, they might ask you to get checked up for a couple of conditions, and they might detect some new medical condition with you.
So in the last few years, it seems like chronic diseases are becoming much more understood, much more focused on, and a lot more discussion about managing them. Why is that change happening?
So currently we are practicing what's called evidence-based practice, which is basically working and treating patients based on the most current research data. Even within last 5 years, research on hypertension, diabetes, COPD, it's keep evolving. New data came out on 2017 for the guidelines for high blood pressure. So anything that is above 130/80, previously which was used to be normal blood pressure, now that's a high blood pressure, stage 1. So definitions are changing, and based on the new research, we have more idea and more guidelines to manage those diseases. American Cardiology Association and American Heart Association came out with ASCVD risk score. That is basically a calculator which gives you idea whether you should be on a cholesterol medication based on your lab work and your overall health profile. And that gives clinicians a very good idea of when to use the cholesterol medication on a patient. So those new researches are very helpful. They are evolving and they are helping clinicians help with these chronic conditions on a regular basis and make sure we are on track of managing them and managing them early in the process of the disease development.
Let's pause for just a moment to hear a message from today's sponsor.
Imagine being able to recover from an illness or an injury in the comfort of your own home. Perry Memorial Hospital now offers professional care from our door to yours. Perry Home Care provides skilled nursing, medical rehabilitation, and education for a safe and comfortable recovery. To learn more, visit perrymemorial.org/homecare. We listen, we care, we are Perry.
All right, so you might have to go into specifics of some of the chronic diseases here, but what are some of the ways that you help people manage and treat chronic conditions?
Well, as Dr. Penmani said, screening is the biggest thing you can do for yourself, is making sure you get those regular screenings, making sure you see your doctor regularly, making sure that you follow through with what you are told to do at your provider's office. One of the things that we also really recommend is if you do have a chronic illness, and say it's diabetes, that you're checking your blood sugar regularly at home, that you are checking your weight regularly. If you have a heart disease of any sort, peripheral vascular disease, any of those, you're checking your weight, you're checking your blood pressure. It's very, very important that you keep on track with what's going on in your body.
And there tend to be a lot of programs available for the specific diseases. I know here we have the diabetic program and COPD program that's getting started up. So for people who have a certain condition, there's resources out there that you'd probably refer them to as well, right?
Exactly. The chronic care management program that we have here at Perry Memorial is designed for patients with 2 or more chronic illnesses. They can be managed by a coordinator, such as myself, that they will actually get to talk with us and go over their goals. Sometimes a patient's expectations are not the same as their outcomes. And so it's very important to talk through those and decide what are the real expectations here that we can have and get the patient involved in that plan of care. By getting the patient involved in the plan of care with chronic care management, what we do is we build a care plan for them, made by them. And one of the questions that is asked most often is, what matters most to you? What do you want to do? Mm-hmm. And that can be, I want to spend time with my grandchildren. I want to travel, all over. Whatever their goal is, then we have to show them in their health, this is what will be possible if you can follow this plan. This is what you can do if you will follow this plan. If you choose not to take care of these things, if you choose not to follow this plan, then your health is going to decline. And so it's sometimes just putting it out on the table and helping people to understand what the expectations are and what the goals are. And sometimes when they can see that forward going, then they do much better. It seems like the more people know, the better they do. So that's a big part of chronic care management is teaching. Mm-hmm. Teaching patients about their disease, teaching them about their medications. Medications is a very, very big part of these chronic illnesses. And when you have chronic illness and you've been prescribed a medication, your provider did not prescribe that medication just because they thought it was a good idea. It's because you need it. And you need to take it the way they told you to take it. And if you have a problem with that, then you need to make a visit back to your provider. And you need to go over that plan with them. And I can't take that Lasix every single morning because then I have to go to the bathroom all day long. Then you need to understand, why it's so important. So again, the more education a patient has, the more knowledge they have, it seems like they do better. So that's what chronic care management is about. It's also about managing all of their providers. Many of the patients with chronic illness have a primary care provider, they have a cardiologist, they have a nephrologist, they have a rheumatologist, and sometimes just coordinating all of those visits together and getting them all into the same electronic medical record so that when they come and see their primary provider, that primary provider is able to look through and see all the notes from all the other providers and see what's going on with the patient, because a medication may have been adjusted by another provider because of a different situation. Mm-hmm. And bringing all that together is very, very important for the patient.
How much do you think fear plays into chronic care?
I think that's a big part of it. People are afraid when they get into an exacerbation of some sort where their chronic illness flares up, it scares them. It scares them bad. And I think of with diabetes, I had a patient one time tell me, I kind of poo-pooed diabetes. I didn't think it was that big of a deal till I went into chronic kidney failure.
Yes.
And then, oh my goodness, this is a really big deal. And so, fear is a great part of it. And I think that sometimes the unknown is what plays into that fear. And there again, if we can educate and we can show you what you can do for yourself and how you can manage this chronic illness, you can do the things you want to do. You just have to follow your plan of care.
And the part about fear, you should be more afraid about having a devastating outcome like kidney failure, heart failure, and stroke. Going to a primary care just to get your blood pressure checked or the screening test done, that should not scare you. Mm-hmm. If you catch a disease early in the process, that's the best for you and your provider. You're catching something early in the process, and maybe you can control it and keep it at bay for a long period of time, rather than going to kidney failure, as Deb was mentioning, or other severe outcomes.
On the webpage for this episode, I'll link to some of the educational resources that we have already for it and some of the programs that are in place. So if it's something that interests you, visit our perrymemorial.org/podcast. You can find the page for this episode and see those resources and check them out and see what's available here at Perry. So, Deb, you've talked a little bit about what chronic care management does here at Perry. What other resources and services do we have here for patients with chronic diseases?
I actually have a book of resources that is just full of people in the area that provide different resources, everything from transportation to sitting with someone while you have to go out to the grocery store or something, to I even have a program set up with the high school where we have some volunteer high school students coming in, and they will take out garbage for people who can't get out to the curb with their garbage. They've carried up things out of the basement for people when we had all the water flooding and all that kind of thing. So just little things like that we can set you up with all over the community. And that's what makes this so wonderful, is because it's the whole community that actually helps to take care of chronic care management. It's just like when you're raising your children. It's the same thing. You have to have a whole community, because sometimes you can't do it all by yourself. And that makes it nice, because we have several people in this area that, because it's a rural community, they live way out in the country, and they're all by themselves out there, or they live in a small apartment and they're all by themselves, but they don't have any other family around or anything. So that makes it really nice that we have such a great community that will always come together and make things possible for people.
And Dr. Pomnani, you're Perry's first provider who's focused on internal medicine, and then you're working also as a hospitalist. Can you describe a little bit about what you're doing with chronic care patients?
So I'm seeing many elderly and patients with multiple comorbidities and chronic conditions. So I'm helping them to manage those conditions. Many newer, younger patients are coming to me just to establish care, and on the routine screening, just basic blood work. And just by checking the blood pressure, we are helping them to get ahead of this chronic diseases and manage them better.
Leaving this conversation, I want to ask you both for one recommendation for anyone who either has and is trying to manage a chronic condition, or just might be at an age or in a place where it might be a risk to them, something you might want to consider. What's one recommendation that you would give?
Don't be afraid to ask questions.
See your primary care physician at least once a year. Make sure you follow up their advice, and they will help you guide through it.
There you have it. So the focus is see your provider, ask questions, have that open communication, and stay ahead of chronic diseases, be able to manage them. It's not as scary as it used to be, because we can keep those under control. So thank you so much, Deb and Dr. Pomnani.
Thank you.
Thank you.
It doesn't stop here. Access other podcast episodes and resources related to today's episode by visiting www.perrymemorial.org/podcast.